You are welcome to Graceland Diabetes Foundation, an international diabetes educators, reaching out to people in United Kingdom, Africa and the world at large. In our midst is Mr. Muhammad Kabir, a representative from Graceland Diabetes International Foundation. You are welcome, sir.
Thank you.
In today's segment, we shall be looking at what diabetes is all about. So what is diabetes?
Diabetes is a disease in which your blood glucose, also known as blood sugar, are too high, which can cause so many problems. Blood glucose is our main source of energy and it comes from the food we eat. It is very important in the body. Without glucose we will not have the energy to do anything at all, we won't be able to walk, work, study or do any of our day-to-day activities.
What are the types of diabetes and who is at risk?
There are three main types of diabetes, namely type 1 diabetes, type 2 diabetes and gestational diabetes. Type 1 diabetes account for about 10% of all diabetes cases and it is mostly common in children, but it can develop at any age.
Little kids. Does that mean everyone is at risk?
Yes, everyone is at risk. But the happy thing is that, it's not a death sentence. Type 1 diabetes results from the body's failure to produce insulin, and currently requires the person to inject insulin or wear an insulin pump. This form was previously referred to as insulin-dependent diabetes mellitus, IDDM, or juvenile diabetes.
Wow! This is a nice explanation.
Type 2 diabetes account for about 85 to 90% of all diabetes cases. It is mostly common in adults and old people, although it can develop at any age. Type 2 diabetes results from insulin resistance, a condition in which cells fail to use insulin properly, sometimes combined with an absolute insulin deficiency. This form was previously referred to as non-insulin-dependent diabetes mellitus, NIDDM, or adult-onset diabetes. The third main form, gestational diabetes, occurs when pregnant women without a previous diagnosis of diabetes develop a high blood glucose level. It may precede development of type 2 diabetes.
This is insightful. Thank you, sir, for your time.
It's my pleasure.
We shall be taking a brief commercial break. When we are back, we shall be focusing on the symptoms of each type of diabetes, the causes, who is at risk, and possible ways to manage diabetes.